When a patient first has a stroke, they're very overwhelmed. They could be in denial that the stroke has happened. So it's a very emotionally overwhelming process to know what's happened and then what's going to happen after they leave the hospital. Are they going to be able to return home? Are they going to need additional therapy? Are things going to be back to normal? If somebody is going through the stroke recovery process, they would want to go to a primary stroke center. That means that we use evidence-based best practice standards from the American Heart and American Stroke Association. And that means that we have dedicated nurses and physicians that provide the best possible care and provide 24/7 care for stroke patients. Stroke recovery treatment complements stroke recovery in that if you receive the best treatment, your likelihood of stroke recovery is optimized. When somebody has a stroke, they're grieving a loss. So they're having to relearn movements that were once automatic. So that can be challenging. Things that we take for granted. So relearning those movements and those tasks can be very trying because you want it to happen quickly and it takes time and patience and optimism. Human nature is that we take the path of least resistance. So if I have weakness on the left side of my body and my right side is stronger, I'm going to be more likely to use my right side because it's easier. So a stroke patient can actually have learned disuse. So if they have weakness on the left side of their body, they may learn to disuse that side. So therapy really needs to focus on normalizing their movement. So you don't want them to compensate, you want them to maximize their recovery by relearning those movements that were once automatic. There are different types of therapy. The most common, that's the most familiar, is physical therapy, which helps patients with their mobility, getting out of bed, getting out of the chair, walking across the room, helping them navigate and negotiate stairs. There's also occupational therapy, which focuses on the activities of daily living, like bathing and grooming and dressing and toileting. It can also involve some more complex tasks, like going to the grocery store or going shopping in the mall, because that involves community reintegration. And then the other type of therapy is speech-language pathology, which works on the ability to talk and understand language, process language, talk and speak, and also thinking and processing information, and also swallowing. Sometimes stroke patients lose the ability to swallow, and so they can do a swallow assessment and actually help to improve the swallow. I like my job because I have an opportunity to make a difference. I manage the program from the time that the patients come to the emergency room to the time that they leave and they're discharged from the hospital, and even on the outpatient therapy side. So I manage the process. And so it's rewarding in the sense that if we can improve our program, then that should improve our outcomes, which means the patient should obtain a better level of recovery.